So when it comes to history, we normally ask if it is a traumatic case, we normally ask the mechanism of injury, like whether the fall was on the outstretched hand, whether there was pushing or pulling. And when it comes to physical examination, it's again subdivided into inspection, palpation, range of motion, and strength. Now we'll go into one by one aspect of this, why these things are very important. And one point I want to add here is that your clinical examination is where you come to 50% of your probable diagnosis. You come to know how to go about your differential diagnosis. You come to know which will be the provisional diagnosis or which can be the diagnosis. That's why history physical examination is so very important in any of the condition or any of the orthopedic condition. So when it comes to history, as I told you, have to go with the mechanism of action, how, when, where the injury has occurred when it comes to traumatic condition. Physical examination, again, inspection, palpation, range of motion, muscle strength. Now we'll go into one by one how to do all this assessment. Now, whenever it comes to rotator cuff muscles or rotator cuff tear, atrophy of rotator cuff is one of the major sighting which you will see when you are doing any of the clinical examination, especially your supraspinatus and infraspinatus wasting or atrophy can be clearly visible if it comes to rotator cuff tear. So as the arrow is pointed out, it shows there's a, if you compare with the other side, the normal side, there's a wasting or atrophy of the infraspinatus muscle. Second comes the palpation. Okay, there's a concept known as Codman's palpation where you palpate the rotator cuff tendon. So what you do, you keep the tip of your finger anterior to the acromion. Okay, and you extend the shoulder. You do shoulder for extension. You will get a defect in the tendon. But once you flex the shoulder, this defect goes under the acromion and it's nowhere available. So Codman's palpation, as they told, is very sensitive and specificity, and it is almost 96 to 98%. That means you can do this test and it will be equivalent to MRI. That is what we know as sensitivity and specificity. And it is around 96 to 98%. And you have evidence and you have your reference for that. So PGs and final year UGs, you can go through this by looking about which reference to go. Next comes the manual muscle strength. Now, MMT we normally do to assess the strength, but in rotator cuff muscle, they have told that when you do the MMT, you can find out that there is some problem or there is some issue in these muscles. The weakness determines the integrity of the rotator cuff. So what they say, when you do full can or full can test, now how you go about the full can test? You do abduction of the shoulder at 90 degrees, scapular plane, and thumb in the upward direction. If the MMT is less than grade 5, that indicates there's some issue with the supraspinatus muscle. You go with external rotation resistant at the side. That means you keep the arm at the side, elbow at the 90 degrees, and give resistance for external rotation. If there's less than grade 4 plus, it indicates infraspinatus issues. Lift off sign, you take the hand behind, elbow again in 90 degrees. If the resistance or if the MMT is less than grade 3, it indicates there's an issue in subscapularis. So it directly we can say that MMT do contribute or do helps in the diagnosis of certain muscles, which in turn helps in the integrity of rotator cuff tear. Now, one more evidence is there where they say that range of motion and strength it estimates the size of the tear. Normally, the size of the tear is determined by MRI, but Naked et al. A geospity article where they have told that you can estimate the size of the tear of a rotator cuff based on the range of motion and the strength of that arm or strength of the shoulder. So what they say is that you can detect there's a large and massive tear. You can detect there's a large and massive tear if you do a abduction of 10 degree, shoulder abduction of 10 degree, and you take the MMT or through manual muscle testing or through your dynamometer. If there's a weakness of more than 50% compared to the unaffected extremity, that indicates there's a large or massive tear. I hope everyone understood. You take the arm and shoulder abduction in 10 degrees, okay? And with that, you do a MMT. Either you can do manually or you can use a dynamometer. If the weakness is more than 50% compared to the unaffected extremity, that means, or it indicates there's a large or massive tear. Right? Now, what are the possible outcome measures which we use for rotator cuff tear? Now, possible outcome measures for shoulder is normally we go with SPADI, we go with DASH, but very typical, very useful for rotator cuff, there are two known as Western Ontario Rotator Cuff Index, rotator cuff quality of life. Then again, yes, you have SPADI and you have DASH. Now, Western Ontario Rotator Cuff Index is a 21 item questionnaire which predicts the injury of the rotator cuff, and it is each question is between the range of 0 to 100, the marks, or what we say, the scoring. While rotator cuff quality of index, it has 34 items and each is different or divided into 5 domains. So depending on the domains and depending on the thing, you divide or you come to a conclusion what is the quality of life for a person who is suffering from rotator cuff tear. Now, rotator cuff tear can be symptomatic and it can be asymptomatic. It's not necessary every rotator cuff tear will be symptomatic. There are few studies which have come to a conclusion that rotator cuff tear, whether it's minor or depending on the size of the tear, it can be asymptomatic also. So these were the outcome measures. Now, the main thing why we have come or what we want to discuss, that is the test item clusters. Now we have gone through history, we have gone to clinical examination, and we are going to come to special test. Now, whenever a condition comes to you or a shoulder condition comes to you, it's depending on these factors which will come to a probable diagnosis. That's why subject data, physical examination, and special test are so important for us so that we physios or the clinicians come to a specific, probable or accurate diagnosis, so that due to our diagnosis, the treatment plan or the management for that particular condition is accurate and the patient care is taken care of. Now, what are the test clusters? As per the definition, a specific group of special tests for a particular diagnosis that has greater accuracy than the single special test as demonstrated by research. So, you have the history, you have the clinical examination, and you are going to come to special test. Now, what is special test? Now, special test is something which helps you to come to an accuracy of a diagnosis. So, as I told, you have one condition, you took the mechanism of action, you did the clinical test, almost 50% of your diagnosis you have in mind. Maybe it will be this way, but to confirm that is the diagnosis, you have to do special tests. Now, there are various number of special tests, and you can't keep on sitting and doing each and every special test because first of all, it is time consuming. Okay. So each and every special test to come to know a diagnosis, it's very time consuming. So you know, most probably this is the diagnosis, but you need something reliable to tell, yes, this is a diagnosis depending on the history and the clinical examination, this was a concept for what test item clusters was developed. Instead of you doing n number of special tests, single special tests for different shoulder condition, this is cluster of special tests which you can do and come to a accurate diagnosis of that particular condition. That is the term, or that is the concept of test item clusters, which most of we physios and the clinicians are not knowing. And this test item clusters is so accurate that for a clinician who has a patient coming to his clinic, he can accurately diagnose a condition using this test item cluster. So it's a cluster. Test item cluster is a specific group of tests which you do for a diagnosis of a particular condition, right? Now, as I told, everything is interrelated. You can't have history separately, you can't have examination separately, you can't have special test separately. There's a integrating or a overlapping of history, examination, special test, and investigation, which helps to come to a probable diagnosis. If everything is aligned together, you get a precise diagnosis, but everything is overlapping, there comes the concept of test item clusters, where you do a group of tests. Now, this test item cluster is not necessary, it has to be a special test. It can be a typical complaint or typical feature which you see in that condition. So it's an overlapping of history, examination, special test, and investigation, which gives the concept of test item cluster. Now, test item clusters statistically is divided or depends on sensitivity, specificity, positive likelihood ratio, and negative likelihood ratio. So these are the four concepts which you should be knowing in briefly to understand what is this test item cluster. So I won't go in detail understanding it, but sensitivity is something which identifies the disorder in a proportion of people, while specificity identifies the disorder which identify the people who don't have that condition. So based on sensitivity and specificity comes your positive likelihood ratio and negative likelihood ratio. Now, what is positive likelihood ratio? Positive likelihood ratio is how much a positive result of the test increases the probability of diagnosis being present. For example, suppose knee impingement came positive for that particular condition. So what is the positive likelihood ratio of knee impingement? It helps us to tell that yes, the positive result of this test tells that this condition, or what we say, there's supraspinatus or infraspinatus condition related to that test. So how much a positive result of the test increases the probability of the diagnosis being present tells about the positive likelihood ratio. Now, what is negative likelihood ratio? How much the negative result of a test decreases the probability of the disease. That means if a test result comes negative, how much that result tells that that person is not suffering from that disease. So that is known as negative likelihood ratio. Fine. So your four concepts, that is sensitivity, specificity, positive likelihood ratio, negative likelihood ratio, are the four statistical concepts on which your test item clusters are dependent. Fine. Now, for rotator cuff injury, what are the test item clusters? Actually, there are n number, but the more precise or more commonly used is by Park et al. In 2005. What they say is, if there's a positive painful arch sign, and if there's a positive drop-on sign, and there's a positive infraspinatus MMT. Now, what is infraspinatus MMT? Is a external resisted external rotation. If all these three signs are positive, plus your age factor is more than 65, that means the person is suffering from rotator cuff tear. Okay. So if you have two positive findings, the positive likelihood ratio is 3.57. That means it indicates that yes, the person is suffering from rotator cuff pathology or rotator cuff tear because the positive likelihood ratio is 3.57. If it is three findings, all the three tests are positives, okay, that means the positive likelihood ratio is 15.6. So if a condition comes and you find the painful arch sign is positive, drop arm sign is positive, and infraspinatus MMT is also positive, that means the person is suffering from rotator cuff tear. So you don't have